So what if I told you the US government's about to change the way we think about health by focusing on less vaccines and more on what we eat? Sounds crazy, right? Well, that's exactly what Robert Kennedy Jr. is doing as a new health secretary. And trust me, his changes are making headlines. Let's talk about it. My name is Shane. I'm a personal trainer and nutrition coach. I help busy women simplify health and fitness so they can make better informed decisions when it comes to their overall well-being. Please take the time to like and subscribe so you don't forget to do it later. I much appreciate it. To those that already have subscribed, thank you so much. I'm gonna keep this content coming the best that I possibly can. So who's Robert Kennedy Jr. and why does he matter? He's a new U.S. Secretary of Health and Human Services. What does that actually mean? He oversees Medicare and Medicaid, the CDC, FDA, and the NIH, agencies that affect public health, vaccines, medications, and food safety. And why is he such a hot topic? He's known for questioning vaccines, pharmaceutical companies, government health policies. He says he wants to make America healthy again by focusing on chronic illnesses, nutrition, lifestyle changes. So here's some of his major changes so far. Let's focus on infectious disease, vaccines, outbreaks. Kennedy said the U.S. should take a break from focusing on infectious disease and vaccines for 8 years. He's cutting funding for vaccine research and pandemic preparedness, less money for developing new vaccines. The CDC actually stopped vaccine promotion ads, now focusing on informed consent instead of urging vaccines. He wants to review child vaccine schedules and investigate possible health risks, despite various promises to leave them alone. So he actually wants to focus more on chronic disease, nutrition, and lifestyle changes, like I said before. Pushes more nutrition and whole foods to prevent obesity, diabetes, heart disease, which is fine, I completely agree with. Wants processed foods removed from school lunches and stricter bans on unhealthy food additives. He's also looking at mental health treatments for children, questioning if antidepressants and ADHD medications are overprescribed. And here's something else, taking a big pharma, meaning drug prices. Plans on lower prescription drug prices and hold pharmaceutical companies accountable. Wants more natural treatments, diet, exercise instead of over relying on medications. Unclear on how much he actually wants to change due to Big Pharma's influence. Okay, let's face the facts, Big Pharma really controls a lot, doesn't matter what you want to believe. There has also been some changing when it comes to government health agencies, mass layoffs, fired thousands of workers for the CDC, NIH, and the FDA to reduce corruption and bureaucracy. But comment below, let me know, actually, I'm not a politician, but let me know what bureaucracy mean. I might be saying it right, bureaucracy. So next, he wants to replace vaccine advisory experts he believes that are too close to drug companies. A little conflict of interest. Critics worry this will weaken health protection and slow medical approvals and disease tracking. Next, he wants to end climate health programs. He stopped the HHS funding for research on climate change's effects on health, which is air pollution and disease. A surprise, since Kennedy was once known for environmental activism. Okay, lastly, federal health programs will now recognize only two biological, male and female. This affects transgendered healthcare policies under HHS, the Health and Human Services. Why does this matter? Here's the pros. America needs fresh approach to health. Food, exercise, and mental health should be priority, not just vaccines. The government needs to stop favoring big drug companies over real health solution. And I hear what the critics are saying. Downplaying infectious disease could bring back outbreaks of measles, polio, the flu. Max layoffs and budget cuts may weaken public health protections. And lastly, ending climate health research ignores growing issues like air pollution and rising disease rates. So what's next for Kennedy? Kennedy's policies are a huge experiment focusing on lifestyle medicine instead of traditional public health measures. If it works, we could see a healthier food policies, lower drug prices, and less disease. If it backfires, we might see a rise in illness rates, weaker disease response, fewer scientific breakthroughs. Your reaction matters, ladies. Let me know what you guys think. I mean, I just hope that they continue doing more research when it comes to women and not prioritizing men. Are these changes good for public health or a riskier gamble? Let me know in the comments below. Should we focus on nutrition and prevention or keep prioritizing vaccine and medicine? Let me know in the comments below. This is not a political channel, but I would love to hear your opinion on this. Please just keep it friendly in the comments below. Please subscribe. I'm gonna keep videos like these coming. Like I said, this is not a political channel, but this is something involving our health. so is something we need to talk about. Thank you for joining me today. If you found this helpful, be sure to share it with someone who might need to hear this message. Remember, prioritizing yourself is a choice you'll never regret. Thank you, and I'll see you next time. Have a fantastic one.